Assisted weight loss and what makes the difference. Hey folks, I'm Dr. Jeff Williams with Creekstone Integrated Medical, coming to you with this week's blog and video. Now, I love sharing this information with you each week. I hope you enjoy tuning in. This week, we're going to talk about the rollout of our brand new medical weight loss program that's meant for you, the people of Amarillo, Texas, and the Texas Panhandle. Now, you know how it goes. Sometimes you just need that extra help for that extra stubborn weight loss. Now, we're going to start here. You heard it here, y'all. You heard it here. Diets do not work. Diets don't work. There, I said it. Whew, I feel better now. So let's talk about that. We're going to tell some stories and offer some solutions, okay? So first, CNBC says that 45 million people in the U.S. every year go on weight loss programs. Now, it's important to understand that the U.S. only has about 328 million people in it, so 45 million of those, ooh, that's a pretty big number considering, huh? As a result, the weight loss industry is now a $71 billion industry. Ooh. Here's the kicker though, 95% of fad diets, they don't typically work out. Again, that's according to CNBC. Now, I'll share a few more shocking stats with you here. The latest numbers put the percentage of Americans that are obese at 42.4%. Almost half of the Americans are obese. Now, let that one sink in just a little bit, huh? Ouch. Not only that, but obesity went up by 30%. Obesity went up by 30% from the year 2000 to 2018. Now, it went up in 18 years by 30%, folks. Obesity directly causes the leading reasons for preventable and premature death, which is great news. These are conditions like heart disease, type 2 diabetes, and certain types of cancer. So if obesity causes these conditions, well, then it stands to reason that losing weight can help lessen or avoid these kinds of conditions, right? 2 + 2 = 4 every time. So that's encouraging. Now let's talk about the bones and joints. Did you know that according to Harvard Health, there are 2 ways being overweight raises your risk for developing osteoarthritis? The first thing is that the excess weight puts additional stress on weight-bearing joints. Now think about your hips and your knees and your ankles and your feet. They've got to carry around more weight day in and day out. And I mean, that's just obvious. They're going to pay the price. We call it arthritis, but what it really is it's your bones' response to extra stress and pressure and wear. Now, when our bones experience extra activity, stress, friction, or pressure, your body naturally builds up more bone to address that new situation, the new stressors. Now, this does not just pertain to older, overweight people. Harvard continued by saying, losing a few pounds can go a long way toward reducing the pressure on your knees and protecting them. For example, research has proven that a sustained 10 to 15 pound weight loss in obese young people can translate to a much lower risk of osteoarthritis later on in life. Secondly, there's the inflammatory part of it all. Inflammatory factors associated with a poor diet and with weight gain likely contribute to trouble in the joints, including joints that aren't weight-bearing, like hands and elbows and shoulders and things of that nature. Now, back to diets. I say that diets don't work, but I should be adding a little more wording to that phrase. What I mean is that diets most certainly do work in the short term. That's why they're so popular. In the long term, however, they just don't typically work at all. The first reason for this is that there is no one-size-fits-all solution to weight loss. People are very different. Their needs are different. The conditions are different. Some need more medical help to get their system kicked into gear. And some just need a little accountability. While some patients need a little help on the brain space part of it because their relationship with food has to be addressed before being able to understand how to best limit it. Some patients need all of the above. And that's why I say diets don't work. They're not typically very sustainable. Let's take Nutrisystem, for example. According to verywellfit.com, the Nutrisystem diet is a portion-controlled eating plan centered on prepackaged foods delivered to your home. The diet is based on the idea that it can be easier to lose weight if you don't have to plan and prepare meals. So the meals in Nutrisystem are pre-planned and delivered, but they're also highly processed meals. That's not good. It's certainly not fine dining in my book. No long-term weight control strategies are taught or discussed, and on top of it all, it can cost up to $420 a month. Now, just going through this, you should be able to see why I say that diets can work for the short term, but this type of setup is just not sustainable for the long haul. Now, that means some weight comes off in the beginning, certainly. Then it gets old and tired. The process, we get beyond it. We're over it. Your motivation begins to wane, and before you know it, you gained it all back, and in some cases, you added more weight than you started with. Another popular fad over the past 20 years or so is the keto diet. Revisiting Harvard Health here, they say, unlike other low-carb diets with focus on protein, a keto plan centers on fat, which supplies as much as 90% of daily calories. And it's not the type of diet to try as an experiment. In the article, registered dietitian Kathy McManus, director of the Department of Nutrition at Harvard-affiliated Brigham and Women's Hospital, she says, the keto diet is primarily used to help reduce the frequency of epileptic seizures in children. While it also has been tried for weight loss, only short-term results have been studied, and the results have been mixed. We don't know if it works in the long term, nor whether it's even safe. Yeah, that's a recent quote, by the way. Now, keto diet risks. It comes with risks, and they are that it's high in saturated fat, which should be no more than 7% of your daily calories due to saturated fat's link with heart disease. The keto diet is known to cause an increase in LDL cholesterol, also known as the bad cholesterol. The keto diet encourages low vegetable intake, which can lead to nutrient deficiency. And metabolizing so much fat can lead to liver issues. Also, since the kidneys help metabolize protein, keto diets may overload the kidneys, which can lead to kidney problems. It can lead to constipation since the keto diet is low in fiber. And it also can lead to fuzzy thinking and mood swings, which results from the lack of sugar that we get from healthy carbs. In addition, while some of us may be perfectly happy eating steak and bacon while avoiding any fruits or veggies for the rest of our lives, for the majority of us, once again, this is not usually very sustainable. So what's the answer then? Well, I would start this part of the discussion by saying that anyone claiming to have the one single right answer to weight loss is 100% dishonest. Turn and run away. However, it really can be boiled down to some simple ideas that can give people the best chance at really doing something about it if they're determined. The first thing is eat fewer calories than you burn. This is fundamental. Remember I said 2 + 2 = 4. It's a mathematical equation. You take in less calories than you burn, you're going to lose weight. The next idea here is burn more calories by being active and engaging in exercise. And this leads you to reasonably be able to eat more calories and have more energy and a better overall quality of life and enjoyment. It's, again, 2 + 2 = 4, folks. The benefits here are countless. Less chronic pain, less inflammation, fewer painful joints, decreased risks of serious life-threatening illnesses, more quality time with loved ones doing fun stuff, and most important of all, a healthy self-image and a healthy self-confidence that you'll begin to realize. Pride in a job well done and reaching a goal you've set, That's priceless. Now, with that said, sometimes some folks need a little extra help, and that's where Creekstone Integrated Medical can come in and help you get across the finish line. We have a professionally formulated, medically assisted weight loss program prepared and available to the people of Amarillo, Texas and the Texas Panhandle that really can give you an excellent opportunity to break through the barriers that have prevented you from reaching that end goal in the past. Our program has 3 levels, offering options from minimal assistance to being very involved. Number 1, skinny shots. This option, of course, is the most minimal level. Skinny shots are a combination of B vitamins, amino acids, and lipotrophic agents, and these are used to improve energy and metabolism while increasing the removal of fat from the body to help patients with generalized weight loss. Number 2, medically assisted weight loss. This medical weight management option will go a long way toward helping you reach your goals. We have combined knowledge and experience from several different weight loss plans and protocols. We combined those with new and innovative medical strategies. Through our weight loss program, you can expect to drop the weight while experiencing more energy and vitality. Through medical assistance, you can control your appetite and cravings. You can learn more about food and exercise and get some ideas that are centered around weight loss in general that can really make a difference. Education really can help you get across the line. You can experience rapid weight loss safely and effectively. You can break down the barriers and reach your ideal weight goal. And you can avoid fad diets that don't work and enjoy long-term weight loss. Now, our third most expensive, most involved tier here is the medically assisted weight loss and brain space coaching program. This is our top tier option and gives many patients the very best option available to get where they want to be and stay there for the long term. This option includes everything from our medically assisted weight loss program, but it combines it with a certified coach, a one-on-one coach, a coach that can help you understand the reasons your relationship with dieting and food has been what it has been. A coach that can help you work through the issues and allow you to have the best opportunity to come out the other side powerful and healthy in the knowledge that not only are you losing weight and doing all the good stuff and being healthy, but going forward, you got this. That's what the coach is for. Our medical provider will provide you with your medical treatment protocol and recommendations to help you reach your goal as quickly as possible. Our protocol is specially formulated to you and your goals. If you stick to the plan and stay consistent with visits and weigh-ins, well, you should lose weight. Although results will vary from person to person, in general, when patients do not stay on the plan, they do not usually lose weight. So the pillars to reaching your weight loss goals are as follows: medical assistance, taking in fewer calories than are spent every day, a behavioral shift, and consistency. Those are the 4 pillars. We all know that weight loss is frustrating. It's frustrating for the patient, of course, but it's also frustrating for the healthcare provider as well. Certainly, when the patient is complaining about not losing weight, but they haven't done anything on their part at home to actually lose the weight themselves. But when providers have a good teammate in the patient, and the patient is bought in with their hearts and not just their wallets, real results and change absolutely usually happen. And they usually happen quickly. We can give you a chance to make it happen for yourself and your family. If you're interested in finding out more about the difference we can help you make in your life, call 806-355-3000. Let's set up a free consultation. We're happy to help you get started and help you be successful. If you're watching on YouTube, subscribe, comment, and share. If you're seeing us on Facebook here, like, comment, and share. It's so easy, and you know that's the way messages get out these days. It's through the help of awesome people like you that understand you have people you love that need some help, and that's what we're here for. So share it with them. Again, I'm Dr. Jeff Williams with Creekstone Integrated Medical. Take care. We'll see you next week.